Come on,
Yeah.
let's get comfortable talking about our pelvic health, our sexuality, our bladder bowel function.
Yeah.
The time is now. There's like the joke of like, she laughed so hard, tears ran down her leg. But actually, I work with adolescent athletes, female athletes, soccer players, basketball players, volleyball players, gymnasts. They're leaking. It is the most preventable condition in women's health that I see. How could we possibly imagine that this baby is going to pass through your vagina
Yeah.
and your vulva and all your tissues and not cause trauma and problems? Of course it is.
Hi, everyone. Welcome back to the Great Connect. Today's conversation is one that every woman should hear. We're talking about the pelvic floor. This is an area of our body that shouldn't be a mystery, shouldn't be taboo, and should be talked about regularly. Kathy joins us to talk about why the pelvic floor is so important, how to think about it, and how to ask and when to ask when you need support in this area. This is the reason that we have built the Holistic Health Hub. These are topics that are not necessarily your average annual exam conversation, but should be. And we want to empower you to take your health back into your own hands by knowing what's important, what to tune into, and how to speak up for what you're experiencing. Today's conversation is just the tip of the iceberg when it comes to learning about the pelvic floor and women's health, but we hope that it encourages you to take the next step in your journey. The Holistic Health Hub is here to support you in that journey, to connect with practitioners, products, and more in order to achieve a happy, healthy life. Let's jump into the conversation with Kathy. Hi, Kathy.
Hi,
Welcome to
Carrie.
the Great
Thank you.
Connect. Yay. While I know you cover a lot of things from a physical therapy perspective, I know you have a particular passion that relates to women. And that is the topic that it feels like is becoming a little bit more normal to talk about, or I hear it more often,
Yeah,
the
thank
pelvic
goodness
floor.
we're finally talking about it.
So,
Thank goodness.
yes,
Yeah.
right? It's like it's a thing we have. It's a body part and we need to know it and understand it. So, start there. What is
Okay,
it?
so
Why
let's
do we
go over
care?
some basic anatomy. What is the pelvic floor? If you think of your body from your head, or your spine all the way down to your tailbone, at the very base of that sits your pelvis. It's this bowl shaped. If you can picture a cereal bowl, okay, those are like the bones, kind of creating this cereal bowl. Except the bottom of that bowl doesn't have any structure, any hard structure like bone to it. It just has soft tissues, which are basically the muscles, like your pelvic floor muscles. Those muscles have a lot of different responsibilities, but you can imagine they're kind of hanging there in suspension without bones supporting everything upward. The muscles are the things like everybody has probably heard of a Kegel. And so that when you squeeze or tighten those muscles, that's called doing a Kegel, contracting those muscles, and relaxing them allows them to soften. But there are so many really important functions of the pelvic floor, holding up our organs, the bladder, the uterus, the bowel, providing stability to that pelvic ring to help with pain, and closing off openings so that we don't leak things when we don't want to, as well as softening and relaxing so that things can pass out of them or into them when we want to. Lots of different things, but really it is the most important muscle group, I think, that our body has, and it goes unknown or undiscussed because it's not that visible to everybody. It's kind of tucked away.
Yeah. Yeah. Well, as you were talking about that, I could envision I was actually seeing a skeleton, right? And how, well, duh. You have all these things on the inside and there's no bottom door. There's no floor.
Yes,
There is no
it's not a
floor,
hard floor. It's a very
right?
soft floor, like a trampoline per se, right? And so
Yeah.
trampolines, they need to be able
Yeah.
to be soft. They also need to be able, to get taut so you
Mhm.
can actually get some spring off of them. And it really is like that. And I think just to even go back, I think a lot of our listeners might relate to this, that we are really the only mammal that spends most of our time upright. vertical. And so other mammals are leaning forward or on all fours. So their organs get a little bit of gravitational support or bony support from the front of their pelvis. Whereas the human female, it really is everything is relying on the integrity of our pelvic floor. I think it's a really unique thing. And it makes us, it's an exciting thing, but it also makes us a little more vulnerable to having problems. So, yeah.
Mm-hmm. Yeah, I'm just reveling in why wouldn't we have talked about this yet? This feels like a pretty core um
Yeah.
group of things to think about and just to learn about how your body
Mm.
functions and not just the skeleton, right? But other key structural components. And this
No,
feels like
you
one
are
of them. Am I
absolutely right.
wrong?
It is so important. And why don't we talk about it? I think we could go on and on about that. But first of all, it's female anatomy, and women are, much less, or have been historically much less discussed or researched in the field of medicine.
Mhm.
And I think it's just also like, come on,
Yeah.
let's get comfortable talking about our pelvic health, our sexuality, our bladder bowel function.
Yeah.
The time is now. This should absolutely be part of
Yeah.
curriculum in schools, way, like for our youth, but also
Mhm.
curriculum really hit hard
Yeah.
with our physicians and our nurses and nurse practitioners. And to be fair, even to our physical therapists. When I was
Yeah.
in PT school over 25 years ago, there was no mention of pelvic floor. None. We didn't talk about it.
Yeah.
So
Yeah.
it's just culturally, I think we need to get on board with it.
Yeah.
So these types of things, this is exactly what we need,
Yeah.
spreading the word. And, way back when I would talk about it, when I got interested
Love
in
it.
pelvic health 21 plus years ago,
Yeah.
I mean, even doctors would be like, what? Are you licensed to do that? Are you allowed
Right.
to do a pelvic exam? Like, you're just a physical therapist. I'd even get people kind of, ooh, what's that? And so there's a lot of weird stigma um, back then. And thankfully, things like
Yeah.
this, it's coming to more mainstream, and women are getting a voice to talk about it.
Yeah.
Yeah.
Yeah. And I want to kind of go back to a question because as we were discussing it and I was thinking about the pelvis and you were painting that picture for me, do men have a
Mhm.
pelvic floor or is it just different? Like, how does, I mean, because they don't have a floor there either. So I'm just curious, we might think about it differently for women than we would men, but is it
Yes, men
the
have
same
a
across
pelvic
both?
floor for
Yeah.
sure, but it's different anatomically. So the outlet, if you could picture the bones of the pelvis, a female pelvis is in general much wider outlet, and that is to allow us to have birth, right? To give birth. But the other thing is we
Yeah.
have
Yeah.
three
Mhm.
openings. Hopefully everybody knows this. Women have
Yeah.
three openings,
Yeah.
right? The urethra, the vagina, and the anus. Men have two, just the urethra
Yeah.
and the anus. So the opening
Yeah.
through the muscular wall. So let's picture that trampoline, right? Women have larger
Yeah.
and more openings in that trampoline. Men just have two tinier ones.
Mhm.
So you can just picture a trampoline that has
Yeah.
more holes and bigger ones, that this leaves us, and then all in a
Mhm.
wider scaffolding holding that trampoline up. It
Mm.
leaves us a lot more vulnerable than men do.
Yeah. And we do things to
Yes,
stretch
yes,
it
like, yes,
at certain
babies and all
points.
that stuff. Potentially, I
Potentially.
do treat men.
Yeah.
I should say that. That's a whole nother podcast, but I do treat men. They do
Yeah.
have issues. They
Yeah.
deserve the right for access to pelvic floor. I also treat women, children as well, which is an interesting, not a lot of pelvic PTs treat that, but it's really exciting to help children. Well, that's for another time, but just to
Yeah.
understand to our listeners, like there's a
Okay.
broad scope.
Okay.
There's a
So
broad
multiple other
scope. And today we're
podcasts.
focusing on the women, but
Yeah.
yep.
Yes. Yes. No, thank you. I think that is important, right? That this is anatomically, we all have it. There are different, just like we both have stomachs and lungs and hearts, etc. But the mechanics of a female body is different than the mechanics of a
Yeah.
male body in lots of different ways. And so, as you're saying that, I'm seeing the trampoline, just the springs
Yeah.
are further apart, right? So you have to think differently about how you
Yeah.
care for that trampoline.
Yeah.
So, okay, what do we need to know? What are the basics of care? Like, where do we start from? Okay, I understand I have a pelvic floor. What's important
Okay.
for me to
So
know
this might
about
be the
it?
easiest way. Sometimes we break it down like by systems. So urinary function,
Okay.
right? Vaginal, uterine
Yeah.
health. That's the next tube. We'll call it the tube in
Yeah.
the, the opening in
Yeah.
our trampoline.
Yeah.
And then bowel function, so let's so urinary, like one
Okay.
thing would be like, how would somebody know if there's a problem going on in any of these systems? So if we just talk about the bladder, for instance, common things that I would see with that would be leaking urine, right? Like leaking pee unintentionally. Sometimes it could be with some type of a movement or force, like the classic cough or sneeze, lifting something heavy, laughing. There's like the joke of like, she laughed so hard, tears ran down her leg. Like that's, you get it. Like it happens, right? So these
Yes.
urinary things, there's also a whole condition of like overactive bladder. Are you peeing frequently? Are you having to go urgently and you just racing off to that toilet, barely making it, sometimes not making it, in time, waking up multiple times a night to urinate? So those things are all kind of in the urinary category. And there are many more. I'm just touching base on some of the most common things, and then we can let's skip to the back opening, the bowel, right? So fecal incontinence
Yeah.
does happen. This is when you're unwantingly leaking stool, having fecal smears in your underwear, inability to hold gas in, those types of situations. Constipation is a huge thing that
Yeah.
I teach people about because it impacts all the other systems as well. And then our vaginal health
Yeah.
and vulvar health, are we having good sex that doesn't hurt and can achieve orgasms and enjoy it? Are we able, can we
Yeah.
receive a pelvic examination to, have a pap
Yeah.
smear and do some cancer screening type things?
Mhm.
So, I mean, there's all these different, so
Yeah.
those are like just some of the
Yeah.
big broad categories. And then another one is pain.
Yeah.
And pain hits all three of these regions of the body. I kind of just touched base on that with sex. There's a medical term called dyspareunia. And if you're
Yeah.
having pain with sex, that is not a grin and bear it. I kid you not, just yesterday evening, I had a new client who told me that she had seen several different practitioners, um, not only a different pelvic PT, but also physicians, and told them that she was having pain with sex after her first baby, and she was told to just breathe and relax and you'll be fine. And it's just, okay, I get it, breathing can really help, but that is to her, and she's telling me this is a story she heard. This is 2 years later, she's seeing me still struggling with this, and the tears are welling up in her eyes as she's talking to me, and she's just like, I can't believe they didn't like listen to me, and that's all that they offered. And why did I have to be the one to find you myself? Why wasn't I more supported by my doctors? And I see that look on your face, Carrie. It's like, oh, my thing is, I wish I could tell these women like this is a unique story, but it's not. I hear them every week, women, men as well, being just dismissed or not
Mhm.
given, more answers, or hey, try this, or seek this help, and that is heartbreaking, but
Yeah.
we're going to change it. And
We
those
are.
stories
I know. I'm like,
motivate me more than
yeah.
anything. It's that individual person
Yes.
who's sitting right across from me, and I feel that blood boiling, my nostrils flared, and I'm like, "Ooh, I'm going to help you, and we're going to keep spreading the word because that's not
Yeah.
acceptable. We can do better. We will do better." And
Yes. Yes. I feel that passion. Every single one of them just lights a little bit more of the fire inside of me. Like, okay, it's still out there. We still have to keep going because not enough people are finding the help that they need. And it's out there. It's out there. It's possible. So thank you for what you do. It's so
yeah,
important. And thank you for being here. Okay, I
yes,
don't want to
don't
get
get
distracted,
distracted.
but Because let's get some more insight. So, okay, we kind of covered the things that we can notice that perhaps we've been maybe a little conditioned into grin and bear it, or these things are normal, or you know, we don't talk about that
Oh, yeah.
here, sort of
Yeah.
thing. They are things that we can start to surface and can move through, and it doesn't have to be that way. So, when you have that client that's come in, what are some steps that we're guided towards? Like, how do we start to work with this muscle? What do we like? Do we work it out? Do we take it to the gym? Like, what are we doing with this muscle, and how
Right,
do I
right.
access?
Well, it's very individualized. There is not
Yeah.
specific prescription of you need to do, you have this problem, you need to do this. But the most important thing
Yeah.
I think as a pelvic therapist is to really listen to my patient, hear um, what they're telling me, and be an impeccable detective. I ask all sorts of questions, and
Yeah.
my brain works like, okay, somebody might tell me that they'll check the box. So I have an intake form that people will fill out, and it asks a lot of questions, but they're really just kind of the tip of the iceberg. But it helps me know when that person comes in front of me what I want to be looking at, where I want to dive and do more detective work. Right? They're just clues for me. So let's just go with one of the common things that I see:
Okay.
stress urinary incontinence. Stress urinary incontinence is leaking of urine when you have a force that comes down, such as coughing, sneezing, laughing, yelling, lifting, jumping, running. Those would be kind of the big ones. But a lot of people will just check the box, and then I want to know, how long has this been going on for you? What was the onset? Has it been your whole life? A lot of us just think like, oh, that happens as a consequence of giving birth. But actually, I work with adolescent athletes, female athletes, soccer players, basketball players, volleyball players, gymnasts. They're leaking. And, so there's a lot of different things that are going
Yeah.
on. Is it that though they just have weak pelvic floors? Or is it possible that they have
Yeah.
tight, tense? I use my shoulders all the time. Like, are their pelvic floor muscles just, shoulders up to the ears, tension? And so then they're so weak and they're not weak,
Yeah.
they're tired because they've been doing this all day. So then when they really need to do that big vault move or jump, it's like they're just fatigued and they're not firing like they should.
There's nothing.
They need to be able
Yeah.
to relax those muscles too.
Hmm.
And there's a lot to say about the coordination of the pelvic floor. So I need to be a really good detective in the questions that I ask, but also in the clinical exam that
Okay.
I do with my patients. And that is always starting like with a whole
Okay.
skeletal look at them. Sometimes I'll have them do big movements, like squats, lunges, single leg balance, single leg dips. I want to see how their body moves. And I may even have them jump. Eventually, I'll usually have them jump. Often I don't try to do humiliating things to people first visit, right? Prep everybody. There's no surprises. I want everybody to know. But I always ask for permission. I think most of my clients that come to me are not only expecting, but kind of hoping for, reluctantly looking forward to a really skilled pelvic floor examination, because I can give them a lot of
Yeah. Yeah.
answers. Once I find that out,
Yeah.
education is everything, right? Like it's not about, I'm going to tell you do this and you just listen to me. It's about me explaining to you. I
Yeah.
have an anatomy book. It is so old, it has been duct taped 20 times. And even this book is it's my little work Bible. I love this thing, but I bust it out every day
Yeah.
and I teach. And I have all sorts of different
Yeah.
pelvic models and
Yeah.
analogies that I share. And because if I can teach
Yeah.
you and you can understand why you're experiencing the things, what's malfunctioning in your pelvic floor, how you can improve it,
Mhm.
then you're gonna be like, I'm
Mhm.
in, and I get this. And I can
Yeah.
say this: I have treated
Yeah.
thousands of patients. I've never had one who didn't get it. Some get it faster than others, but when I take the time to teach, they all understand. It becomes a really
Yeah.
exciting, enjoyable,
Yeah.
and empowering thing for these people, because then they're like they can make the decisions for themselves. They can go back to their doctor or their nurse practitioner, whoever, and have a really good conversation and feel empowered and understanding
Yeah.
that they have control. So,
Yes.
whew, that was a lot.
Yes. Oh, I love it. I love it. I mean, I think that empowerment angle of being able to walk away not just feeling better, but also more tuned into our body, and then being able to recognize things and then speak up, like having the language, right? We don't necessarily have the
Yeah,
language until we move through that
yeah. I love
experience.
that. I give them the language to understand
Yeah.
and, yeah, live within their body.
And to ask questions, I think. Yeah, so often, right, we have practitioners or doctors or whoever that happens to be, and it may just be that they don't have the language, or we don't know what to ask
Mm.
for or how to share what's
Yeah,
happening for us as to what to speak for. And I love that you're equipping people with, okay, now I understand how this part of my body should work, is working. When it's off, this is what's
hmm
happening for me. And I can notice it, and then I can speak up for the support that I need. Like that's a lot of work that you're offering to them and supporting them with, to be able to um, kind of thrive in that environment where they maybe haven't
Well,
felt
and
empowered
Carrie,
in the
on that same
past.
note, I would say when you go to see your healthcare provider, do not expect them to ask deep questions about your sexual
Yeah,
health, your bladder and bowel health. That is not standard of care to be
yeah,
asked all those questions. I'm going to ask
yeah,
them. I'm going to ask a lot of questions.
yeah,
Some might make people blush, but if we need to pull back, I can, read my audience and go with it. But I think that the way that I'm
yeah,
really comfortable in talking about things normalizes it for my
yeah,
patients. And one of the empowering things isn't just
yeah, yeah.
understanding, but it's like having that courage to talk to your healthcare provider and be like,
Mhm.
no, this is really a problem. Like, sex has really become painful for me and I need solid answers. What can we do? How can you help
Yeah,
me? So,
yeah,
we have to be armed with what we need to bring, to the table and really feel no shame about
yeah,
that and just say we need help.
yeah,
And a good provider, if they can help you, they're going to do it.
yeah.
And if they can't, they should refer you to somebody else. Again, that doesn't always happen. So if it's not working for you,
Hmm.
build your community, go elsewhere and keep seeking, but do not give up.
Absolutely.
Like, don't give up. The people
Yeah,
that I treat who have pelvic pain
yeah,
conditions, so these are kind of chronic, ongoing things. It's not just pain with sex. It could be hip pain, glute pain, all sorts of different
yeah.
tailbone or coccydynia pain. These people often
Mm.
have seen six-ish providers before they end up in my office without really getting anywhere. So it's just don't give up on the journey. That would be one of my huge things. Is it's just, okay, you know what? That's not the answer. I'm not done. I'm going to keep moving forward. Don't give
Yeah.
up. Yeah.
Keep moving forward. Yeah. Oh, that's really important. I mean, I'm like you, I'm an investigator and a detective, so I can't stop until I feel like I get the answer, but I know how easy it is in the system that we currently exist in to kind of feel like you got to a dead end, and well, this is just how
Yeah.
I live now. And it doesn't have to be like
Yeah.
that, but it can be really challenging to find the support and keep going. You made me think of a couple questions that I'm hoping will be supportive, because we talked about the three different holes, right? And tubes, and maybe we noticed something, and then you kind of broadened it into other pain areas like chronic hip pain or low back, tailbone, etc. If we're feeling pain, like if we're having, maybe it's just yes, the pee after I've had a child, and I've accepted that that is how it should be after I've had a baby. Um, Will that start to grow into other areas? Like, can the small incontinence start to grow into, now I have other issues in other places? Like, how connected are those three whole? I mean, it's one trampoline, but
It's connected.
does it start to ripple out?
Absolutely. Yes, I
Yeah.
love the way that you're thinking, but because
I mean,
what that is that is a preventative mindset, right? Like I try to have
yeah.
a crystal ball and I can see this person in front of me and I want to see what her future is. And it's like, if you're just, oh, it, because a lot of
Yeah.
women will literally check the box, oh, but that's not really a big deal. It's just only when my bladder's full and it's 3 sneezes in a row that I have that little leak, and I had 2 kids. So
Yeah.
it's not that big. They're kind of just
Yeah.
dismissing it. But here's the thing, if your trampoline base,
Yeah.
if your pelvic
Yeah.
floor is not strong enough and coordinated enough to tighten up those little the openings so that you don't leak pee, what's to say that that trampoline isn't going to be strong enough over time to hold up your organs? Your organs are your bladder, your uterus, and your bowel. And
Yeah.
when those any one of
Yeah.
those 3 organs starts to drop down into the funnel shaped bowl, we're talking about a condition called prolapse. And this is not, this is, in my opinion, it is the most preventable condition in women's health that I see because there's usually some little signs in advance, that little bit of leaking that you have, struggling with constipation and having to strain on the toilet, um, a little bit of heaviness, difficulty keeping a tampon in. These types of things are all
Yeah.
little signs that as your detective, I'm looking for and I'm putting together a puzzle piece, but I'm also seeing into the future. Like if we don't remedy these issues, there's going to be downward forces and pressure that are going to come over decades of time, right? We see in other areas of our body the gravitational forces, right? The pulling downward. So remember, our pelvic floors, the
Yeah.
bottom of that bowl doesn't have bony support, it has soft tissue
Yeah.
support, right? As we age, the bones in my
Mhm.
face aren't necessarily changing, but the skin sitting on them does. Same thing internally. And so it
Yeah.
is extremely important to take care of these little things while you can, and then you're preventing
Yeah.
big time, bigger problems, surgical
Yeah.
remedies, things like that that you would need down the road. And all the while, it is extremely empowering to be that woman who can jump on
Yeah.
a trampoline or still run a 5K or chase her kids around in a playground,
Yeah.
or lift a heavy weight and not have issues. It really does like lift you up. So yeah, you're right.
Yeah.
It is all
Yeah.
these
Absolutely.
different systems and openings. They are completely intimately connected and one impacts the other. And it's really important to get them taken care of.
Okay. I that's really striking a chord with me just from like thinking about longevity and my health and wanting to really intentionally do things at this juncture in my life to support me to be able to have strength and capability and flexibility and all the things as gravity continues
Mm-hmm.
to pull me down over the course of my
Yep.
life, right?
Yep. It happens.
And so I really like that thought of, you know, what can we focus on today? And I want to take one more kind of side step before we kind of go into the next path, which is okay, so we talked about that part. So if I'm having hip pain, like what is this pain that's kind of in the structural bones that could be, I should be talking to somebody about my pelvic floor, not my hip flexor, or like, how do I start to know that this might be something I should explore for that type of pain rather than
Right,
one of
right.
the three
And
holes?
so I think that's really important. Like my background is still orthopedics and sports. Like that's what I got into. And then through one major event 21 plus years ago, really catapulted my career moving toward pelvic health stuff. Um, but during that time, right? So my foundation is really in ortho and sports. And you heard me in the beginning of this talk, like I look at the whole body and it is
Yeah.
all intimately, related, but especially when it comes to our hips and our movement patterns. that a lot of times it's not just like you could have a true hip labral problem, um, which is an orthopedic condition,
Mhm.
but that also there could be a link
Yeah.
going to your pelvic floor. So it's not to say that doing only pelvic floor is going to cure your hip pain, but there's often a couple
Mhm.
different things, going on in there. For instance, if we just think of the alignment of the pelvis, if anybody can picture a structural pelvis in their head, it can get shifted in different ways, anterior, posterior, in and out. And what's anchoring onto that are your muscles, not just the muscles of the pelvic floor, that trampoline, but also the muscles of the glutes and the abdominals, the inner thighs, the quads, these tiny little hip stabilizers that are deep to your gluteus maximus. And those all, can be definitely impacted, if you have pelvic floor dysfunction or something going on there. But also the opposite could happen if you're having structural alignment problems,
Yeah.
that are also impacting your pelvic muscles or the length tension of those muscles. That can also then impact what's going on in a more orthopedic perspective. Another thing to note is just that the majority of the pelvic floor muscles, they anchor on the pubic bone in the front, and they also attach in the back onto the tailbone, which is called the coccyx, and the sacrum. So I see a lot of low back pain, tailbone pain, that is, deep
Mhm.
glute pain that is
Mhm.
related
Mhm.
to pelvic floor. But there are a
Mhm.
lot of people, not every appointment that I see somebody, are we specifically narrowing in on their pelvic floor. We're going globally and treating all kinds of things too.
Sure, because the leg bone's
Yeah,
connected to the arm
in
bone,
a
right?
way,
I love
yes.
that, song
A few
just
other bones in the middle,
way,
but
right?
yeah.
But, like, just the reminder that it's all one system. There is, like, you can't always pull this one over
Yeah.
here and not expect something over there to, shift at the same
And
time,
how you
right? So,
move, how you
um,
sit, what
okay,
you do
that
repetitively, and
yeah,
how you sit at your computer,
yeah,
how you carry a kid on one side, it matters. And so it does, it all impacts it.
yeah. That's fascinating. Yes. I was going to ask about what is it connected to and like which body parts, um, additional things. And that's, there is so much, so many people just accept low back pain as sitting at the
Hmm.
desk, and all those things are impactful. And also, why are we accepting pain as
Yeah.
normal anymore? I think we need to move
Yeah.
beyond that. Just a passion.
Sounds like another
um,
conversation we need to have.
to stop
Yeah.
yeah,
Pain.
accepting. Amazing. Okay, so let's talk to the women who have
Okay.
had a baby and them
Okay.
specifically. I'm one of those. Um, what should we understand about that process and the impact that it has on the pelvic floor? What should be things we do pre versus postpartum? Um, and really bringing this into the conversation of I'm having a baby and this is going to impact my body in lots of different ways. I should be thinking about that as a part of preparation and then recovery from this
Hmm.
massive impact that we're
Yeah.
taking into our body.
If you're so we're going to talk specifically about, the perinatal phase of life, right? And so if you're the woman
Yes.
who's
Yeah.
been so fortunate as to, never had a problem with your pelvic floor, and now you find yourself pregnant and you're super excited about it, right? There are even in those
Yeah.
situations, this is like the perfect opportunity to learn more about your body. And so I love it when I get the opportunity to see a woman. I usually, unless there's a complication going on, like, come find me sometime like in the maybe the middle of your second trimester, and let's just do an examination, and and see how your body is, and I get to know and teach you about your body before the trauma comes down the pipeline, right? And that is whether you
Yes.
have a vaginal delivery or a cesarean delivery, right? Just carrying a baby, you just
Yeah.
think about that load on your trampoline. I have a great analogy. I live in Park City, Utah. We are a ski town, with the exception of this winter where we have not had enough snow. Um,
Oh,
Oh,
we
I'm
had
so
plenty. Send that
jealous.
too.
But okay, I literally did this. I had a trampoline in my backyard, okay? And we know in a ski town, you have to take the springy part of your trampoline off before the snow flies, okay? And if you don't, here's what happens. It snows, and that layer of snow sits on the trampoline. Then it snows again, and the next layer adds, and so on and so on. This is like pregnancy. This is like your growing baby down, down,
Yeah.
down, right? So as you're pregnant, you are getting stretching forces going downward. And I kid you not, Carrie, that winter, finally the spring, the snow melted, and my children went out to jump on the trampoline and came in. Something's wrong with the trampoline. It's not fun anymore. It doesn't bounce. And I was like, this is the exact analogy for the pelvic floor. I'm sorry. I make myself laugh all the time. So, like, I was like, oh my gosh, this is just it. Like, I need to, because I love to teach in ways that are relatable. So, like, vaginal delivery, cesarean delivery, you carry a baby, there are going to be downward stretching forces that are going to change things in your pelvic floor. This is the perfect opportunity in your life to seek out a good pelvic floor therapist and start to learn about your body. If the person has really no complications, I will teach them birthing strategies, like different positions for labor and delivery. We'll make sure that their pelvis is staying in good alignment. We'll be monitoring their abdominal wall for what we call diastasis rectus abdominis, or this separation that naturally, healthily occurs, but that we do want to manage, right? We're going to be already working on, can you
Yes.
fully relax your pelvic floor? This is so important for birth. Do your hips open nice and wide.
Yeah.
You know, if you're having issues with constipation, we're going to hit on that. If you're starting to leak, or you have been a leaker, we're going to work on those things too. And everything that I'm teaching you in the visits while you're pregnant are going to be immediately applied to your postpartum scenario as well. I like women to know this is what you do in your first 24 hours postpartum. This is what you should do in the first week. These are the things
Yes.
you should not do to protect your pelvic
Yeah.
floor. And so for me, it's, of course, I'll see you if you haven't, if I didn't get to see you before you had your baby, but it is really nice because I'll say now you know, your pelvic floor is functioning 5-star rated here. These are the expectations. This is where we're setting the bar for you postpartum. And it really, truly does make that postpartum recovery much better. So if someone's having some complications, pain, leaking, whatever, then maybe I'll see them on a more frequent basis throughout their pregnancy. But if they're doing good, then
Mhm.
maybe even just 2 visits. Let me just teach you so you know, maybe 3 visits. And then I like to see my mamas
Yeah.
between 2 and 3 weeks postpartum. Again, unless there's something else that is if there's something bothersome, then I always high prioritize those clients. And I like 2 visits, at least 2, before that infamous 6-week
Okay.
postpartum checkup. And this is whether it's vaginal
Yeah.
or cesarean delivery. And these are my gals, like
Yeah.
they are doing so well. And by the time they go back to their 6-week checkup, they already have great things to report. And then I like to see them all the way until they are running and jumping. I want my gals being able to run and jump because,
And you just had a baby. That
and I don't
baby is
want it
gonna do it
early.
too.
I
Yeah.
don't want you to do it early. There's the right,
Yeah.
we need to protect and
Yeah.
recognize, like you said, Carrie, it is going to be damaging to your pelvic floor. I don't know why we just don't say it. How could we possibly imagine that this baby is going to pass through your vagina
Yeah.
and your vulva and all your tissues and not cause trauma and problems? Of course it is. But there are ways, the body wants to heal,
Yeah.
but you need assistance. This is
Right.
not the time to just wing it
Yeah.
and just go to your 6-week checkup and it's like, yep, all good. Go ahead, do what feels right. Listen to your body.
Right?
How do you listen to your body when it's not even like connected and you don't know, you know? Um, yeah, so I mean
Mhm.
there are so many
Right.
things
Yes.
postpartum, pregnancy as well, find yourself a good,
Yeah. You're giving me so
qualified,
much FOMO of the stuff
and
that I wish
that's
I'd
okay.
known.
Don't Okay, so that's another one of the things is like it is never too late. It is never too late. Just
Yeah.
last week,
Yeah.
I saw a woman who's in her mid 70s. She's never she's birthed 3 children. She's like, "Oh, where were you, when I had my babies?" And I was like, "Well, I think I was in elementary school, I wasn't here." But it's never too late. You can always learn
Yeah.
and improve. And
Absolutely.
yeah, so
Yeah. Yeah. Yeah.
yeah.
Yeah, I really appreciate what you said about having the baby and the knowledge going into it. And yes, having a baby is something our body is designed to do, and having the knowledge about how the body works and how to support it to me is what's so empowering about what
Hmm.
you do and so many people in this space do, because it isn't about trying to fix the body. It's working with the body and the understanding of what the body is trying to accomplish and being able to sense whether it could use additional support or what makes sense at the right moment. Like, this is a unique moment also for your body. So, how can you build the support
Totally.
system
But
around your
yeah,
body
and
during
here's the
that
thing,
time?
you're going to have all
Yeah.
sorts of healthcare providers all up in your business during right? This is the time to get
Yeah.
real and get comfortable
Yeah.
in your own skin and your own body if you haven't done it yet. And this is for, I don't care what age you are listening to us right now, like identify with your pelvic floor, get a mirror out, look at your body.
Yeah.
It sounds so silly, but it's like,
Yeah.
hey, we're looking at our biceps, we're looking at our abs, you know? It's just tucked away
Yeah.
parts.
Yeah.
They're just a little more secret, but
Yeah.
it is the most perfect time. And then again, it is such an opportunity to prevent things that you don't even know are coming down the pipeline. When you have a baby, all you're
Yeah.
thinking about is right there in that
Yeah.
moment. But just to touch base like on some of the future
Yeah.
things, right? Like perimenopause
Yeah.
and
Yeah.
hormone changes, and then menopause and significant
Mhm.
drops in our estrogen and
Yeah.
progesterone. And then let's even go a step further into that crystal ball and talk about our bone health
Yeah.
and osteoporosis, right? So I'm looking at you, the woman who had the
Yeah.
baby, and you're leaking, and so you're going to be avoidant of running and
Mhm.
jumping and lifting weights. But I can see you. You might be 33 years old right now,
Mhm.
but I can see you when you're 53. And I can see that you're going to have a lot of problems, like,
Yeah. Yeah.
with your bones and rapid bone
Yeah.
loss if you haven't
Yeah.
been, really putting stressors on your bones through your muscles to encourage,
Right.
our bones to stay dense and strong. And it is very
Yeah.
important.
Yeah. What a beautiful thread.
It is.
Yeah. What a beautiful thread you just touched on, right? Like this, you may not be thinking about the little bit of leaking that you're writing off as not a big deal and it's okay and all that stuff. But is that tiny little bit of leaking preventing you from getting back into the gym or that favorite class that you used to, Zumba class that you used to do that you won't do anymore because of it? Like, just tune into yourself. Like, am I allowing this to prevent me from doing and
Yes.
living and doing or being in a certain way? And
Yes.
that's
It's really important,
wow.
Carrie. Like a big
Yeah.
take home message is get real with yourself and ask these questions. And and even like, let's just talk about
Yeah.
sex and intimacy. If it's hurting for some reason, now you're avoiding that. And we know that when couples stay intimate, their relationships are healthier, they live longer,
Yeah.
their longevity is better, mortality and morbidity are lower.
Yeah.
So, sexual health, bladder and bowel function,
Mhm.
lifting weights, exercising,
Yeah.
this is the bread and butter of a happy life or a happy body, the name of my business, right? Like
Yeah.
happy
Living.
body. This is
Yeah.
it. That's why I named my
Yeah.
business that. It is actually really important. And if you can't see it, I'm going to make you see it. I am very convincing to my clients about why
Yeah.
these things matter and why it's important, and removing stigmas or
Yeah.
shame and instilling them with, you know,
Mhm.
empowered choices, really. So, yeah, get real with yourself.
I love that.
Talk to your
I love
friends, your mother, your
Yes.
daughter, your cousins, your whoever,
Yes.
your friend, like get real and open up these conversations and then find providers that can help you. Yeah.
Yeah. Yes. Ugh. Oh, yes.
Mhm.
Yes, do it. And if you happen to be in
Mhm.
Park City, of course, Happy Body is the place to go. But share any last thoughts and or things that you want to share that we can
Oh,
drop
yeah, yeah, yeah.
links,
Yeah, yeah,
of
yeah.
course, to be able to connect with you. But is there anything else that you'd like to share with the audience before
Gosh,
we wrap for the
I
day?
mean, if anybody wants to connect with me, they could do it through the Human Array for sure. But also my website directly, happybodyphysicaltherapy.com. You can email, you can call. I am a good resource even from afar. You know, we could do a virtual appointment, and some of that I help you find a practitioner in your area because I can help a little bit virtually, but the reality is you need a good in-person, pelvic floor therapist. And I think just be brave
Sure.
and share your stories with,
Yeah.
your community, and be bold when you sit in front of
Mhm.
your healthcare provider, and just don't accept the
Yeah.
things that aren't feeling right for you. I feel like our United States, our American health system is really set up for just like acceptable ranges of things and acceptable health. And I think we should really be looking at
Mhm.
optimal health and optimizing
Mhm.
everything that we do. So don't be
Yeah.
shy, and I'm here. Reach
Yes.
out if you want to.
Yes.
Yeah,
I love that. If nothing else,
I
to
do
have the
too.
cheerleader in your corner to be like, "Yes, ask the question. Yes, keep going."
Yeah.
It is so important. I love that and couldn't agree with you more. This has been amazing, and I have so many more questions, so clearly we have other
Hmm.
topics that we could dive into another day because this is a great topic for all the different areas and stages of life. And I'm just excited that we got to scratch the surface and hopefully pique the interest of those that maybe haven't thought about the pelvic floor yet and now have the opportunity to start investigating for themselves.
Wow.
So
Thank you,
thank you so
Carrie.
much, Kathy.
I
I
really
really
appreciate it
appreciate
too.
that.
This has been great.
Oh, awesome. Yes, enjoyed this so much. Thank you, everyone, for tuning in. We'll see you next time.